Good afternoon, and thank you all for joining us. Today I'm pleased to be joined for today's update with Andy Field, who is our Park and Recreation Director for the City of San Diego, as well as Doug Moore, who's the Executive Director of the United Domestic Workers of America, UDW Local 3930, and as well as Nicanora Montenegro, who is a home care provider and a member of UDW. But before we start, as I think some of you know, today is National Nurses Day. And just on behalf of all of us in San Diego, thank you to all of our nurses out there. Thank you for the life-saving work that you do each and every day, and particularly during this time of COVID-19. The lives that you are saving as you risk your own health during this, and you do it for all of the right reasons, our city says thank you from the bottom of our heart. And thank you, thank you, thank you for continuing to do all of the great work that all of our nurses do. Today, I'd like to provide just a couple of updates. First is going to highlight the work that our service workers and our social calls program that is helping to check in with our seniors. And then second, I'm going to talk about some of the works that San Diegans continue to do to help step up in this time. But the first topic, and an important one, because the work with our seniors and our senior population during this time is more important than ever. We continue to take action, as you know, on the reopening of parks, our beaches, and our local business, and we continue to work with all of our partners on how we are going to reopen more parts that are critical to our community, like schools, like places of worship, and even though things are slowly reopening, and that is something that San Diegans have worked very, very hard for. It's important to note, of course, that our seniors remain one of the most vulnerable populations. And so during today's update, I wanted to take some time to focus not only on our great seniors throughout the entire region of San Diego, but also the resources that are available for them and the people who are working to help protect our seniors. As I said, today we are joined by the United Domestic Workers, and they care for people who are confined to their home. More than 29,000 members of UDW here in San Diego, and they're a lifeline. These in-care home workers are an absolute lifeline for thousands of San Diegans who cannot risk, obviously, some of the things that happen outside of your home. They buy groceries for those who can't shop. They pick up prescriptions for those who can't visit the pharmacy. And they provide, of course, kindness and care for those who would otherwise be alone. Their clients, of course, are some of the most vulnerable that anybody is dealing with during the COVID-19. And that puts all of our domestic workers on the front lines of this emergency. And today I think it was important for us to highlight some of the work that they are doing because if they get sick, those under their care will get sick. And so we can't let this happen. Our care workers are in need of additional PPE, personal protective equipment. UDW is accepting donations of masks, of gloves, medical grade disinfectant, and hand sanitizer. They then get that and they distribute those to their members as quickly as possible. In a moment, I'm going to turn it over to Doug Moore with UDW to go over more of the details. But before I do, I also want to talk about another resource for seniors. I'm encouraging all seniors who may be watching this afternoon who are interested to sign up for the City of San Diego's Social Calls program. It's operated by our city's Park and Recreation Department, and it offers comfort and it offers conversation to all seniors. Of course, some of the who are most vulnerable and susceptible to the virus. We know that many seniors are alone right now, and maybe you can't see your friends, you can't see your children or grandchildren, but I want you to know this is a great program. Where you can get that call, you can have that conversation, and talk to somebody, and it's going to be a compassionate voice during this pandemic. And oftentimes that's exactly what somebody needs to hear on the other side of that phone call. And it's a reminder, I think, to all of us that we're in this together and that we're going to get on the other side of this together as well. So if you're interested in being a part of this call program, to sign up, please, you can call 619-236-6905. Staff will contact you each morning to check in Monday through Friday between 8 and 10 a.m. This is free of charge. Staff will ask you if you have any needs or just have a conversation if you want to talk. And sometimes that's a very good thing. We do have staff that will be standing by and ready to help you. So again, that phone number is 619-236-6905, or you can also go to sandiego.gov/coronavirus. Now, I would like to turn it over to Doug Moore to say a few words about the in-home care work that UDW does, the life-changing work that they're doing, particularly for our seniors, and the important needs as they are accepting donations for additional PPE. Doug, welcome, and thank you for being here today.
Thank you, Mayor Faulconer. We greatly appreciate you including UDW in your update today. UDW is a union for home care workers by home care workers. And as the mayor said, we represent 29,000 in-home supportive services caregivers in San Diego who care for seniors and people with disabilities in their homes. They save lives every day, and now they find themselves on the front lines of the COVID-19 crisis. These critical workers provide care in the most intimate, infection-susceptible settings, and they do it for a little more than minimum wage. Caregivers are the invisible heroes. However, they are at times treated like a disposable workforce despite their essential work. Today, we are requesting additional support for the caregivers from the county and from the state. We need more PPE, not just for those caring for clients who are already sick with COVID-19, but for all IHSS providers so that they can prevent the spread of this virus. We also need to ensure county social workers are quickly approving extra hours for IHSS recipients who have increased needs due to the COVID-19 virus. But we're not just asking for help. UDW members are giving back. And today, I'm excited to announce Carina Care, a new child care matching service that connects parents to local, affordable, and safe child care. Carina Care is an easy-to-use web-based platform available to essential workers through a dedicated link that is provided to them by either their employer or their local union. Child care for essential workers, including caregivers, is critical for all to navigate during this crisis. COVID-19 has shed a light on the critical support that frontline workers like caregivers offer to our communities. Let's respond by giving them the support they need so that they can continue to do their jobs in a safe manner. Thank you again, Mayor Faulconer. We greatly appreciate your time and support, and our members are thankful for your acknowledgement of their service to the city of San Diego. Thank you.
Thank you, Doug. Thank you for your leadership. And now I'd like to invite Nicomora Montenegro, who is one of those frontline providers, as we talked about at the very beginning, unsung heroes on the front line of this crisis. She is an in-home care worker herself. Nicomora, thank you for the work that you're doing. You are helping San Diegans. Your work is invaluable. Your city and your county stands behind you. So please come up and share a few words for those watching.
Thank you very much, Mayor Faulconer. Thank you very much, Executive Director Doug Moore of UDW. And thank you very much to all those who are listening out there. And thank you very much for giving us a face and a voice. We know that the caregivers, in-home supportive services, service providers, had been working at home, and as what our Executive Director, we are actually invisible people. But thank you, Mayor, for giving this opportunity. Our union had provided us a face and a voice. I would like to inform everybody, I am Nicomora Montenegro. I am an in-home supportive service provider. I'd been caring for my mom, who was physically disabled, together with my sister, who is developmentally challenged. And taking care of the two of them was actually just giving me 2 hours of sleep a day. You may not believe it, but at that time, I had to do peritoneal dialysis on my mom 4 times a day. And the schedule is 12 midnight, 6 in the morning, 12 noon, 6 in the afternoon. Every day I have to do that. My mom's heart cannot handle the hemodialysis machine. My mom's heart cannot even handle the peritoneal dialysis machine, that I have to do the peritoneal dialysis manually. And my window for sleep is only 3 to 5 in the morning, 2 hours of sleep in the morning, which I can even lose when I do first aid on my mom because her blood pressure were roller coaster, and I have to do first aid on her. When she has that condition, then forget that sleep. My situation is not worse. We have many providers out there who are actually having worse condition and situation that I do have, and I speak for them. Caring for the disabled members of the community is actually exposing us not only to COVID-19 but for other infectious disease. But we are the most vulnerable because we are caring for them. But it is our responsibility to ensure that they do not contract the disease. So we have to protect them as we protect ourselves, as we protect the family to whom we go home to. Therefore, we, as what our director said, we are in need of the personal protective equipment. Because we, as home care providers, are not only essential workers. We are frontliners, and our work is not expendable. So I ask everybody, and thank you for this voice and face that you have given to us, and thank you for at least noticing the previously invisible people like us and provide us what we deserve. Thank you very much.
Thank you. You saw the passion. You're not invisible at all. You're doing life-changing work. And I want to thank all of our home care workers. I'm happy to give you that voice. The fantastic work that you are doing, the efforts that all of us will be working on your behalf with all of our partners in terms of additional PPE, with the county, with the state, with private donations, which that call has gone out today. But it's a big thank you. It's a big thank you for a working day, working at night, making a huge difference for those folks that cannot go out, that need that help and that support. Again, to all of our home care workers, to all of our nurses, we're proud of you. We're very proud of you. Next up, I'd like to invite our Park and Rec Director, Andy Field, to talk about the social care calls program that I talked about earlier, that any senior can sign up for, to have that call, to have that check-in, to have that compassionate voice on the other end of the line. Andy?
Thank you, Mr. Mayor, and good evening, everyone. I, too, join the mayor in thanking all of our hardworking nurses during this time of COVID-19. When people think about the Parks and Recreation Department, people consider the young and the youth of the children who come to our recreation centers and recreate. But we also offer a very crucial and core service to our department, which is to connect with our older population. For the past 45 years, the City of San Diego's Age Well Services program has been providing events, activities, and other venues for them to enjoy one another's company, to recreate, or just share a cup of coffee. During the COVID-19 pandemic, many of our older residents may be feeling especially vulnerable or alone at this time as a result of the social distancing measures that have been put in place. For those who are dealing with those lonely moments during this unprecedented time, we want to make sure that you are aware of the free service the city has offered for the past 15 years and continues to offer today. It can help you stay connected. Age Well Services staff and volunteers will offer a daily social call to older residents just to say hello, see how you're doing, make sure that everything's okay with you and that you have your needs met, and to feel connected to the people around you in a time frame in which you can't do that on your own and connect with people physically. This daily call provides a friendly, sympathetic voice to help older residents feel connected. In addition, staff can help answer questions and provide recommendations to vetted community resources, including transportation alternatives, virtual health, wellness opportunities, food selection, grocery stores, and mental health referrals. Staff makes these calls every Monday through Friday in the morning between 8 a.m. and 11 a.m., and we are able to provide the calls in either English or Spanish. The program continues to grow, with 75 residents currently taking advantage of this program, and we have the capacity for more. So please, if you'd like to participate in our social calls program, or you have a family member that you'd like to enroll as a gift, please call us at 619-236-6905 or email us at thescroll@sandiego.gov. Again, that's 619-236-6905 or thescroll@sandiego.gov. For additional information, please also refer to our webpage, which is sandiego.gov/agewell. Thank you very much. We hope to talk to you on the phone very soon. Thank you. Mr. Mayor?
Thank you, Andy. And lastly, for today's update, our continued efforts to highlight San Diegans that are stepping up in this time of need. Today, one San Diegan that is stepping up to really help connect those that are feeling isolated right now is Shifra, who manages Social Bridge, which is a local organization with a network of about 300 San Diegans that helps prevent social isolation for local seniors by connecting them with younger volunteers. Before the pandemic, of course, that might have meant having a conversation or a cup of coffee or helping to join with a book club. But of course, that has changed right now. And so there's a lot of people that are unfortunately feeling isolated because of the stay-at-home orders that we're all under. So Shifra and the folks at Social Bridge transitioned from in-person meetings to phone calls, what we've just been talking about today, emails and package drop-offs. They now have volunteers that are out there shopping for seniors and picking up groceries from the food bank on their behalf. But they were just getting started when they started that. Shifra and her team are expanding their outreach to serve other seniors that were previously unaware of the program. They have developed now postcards that allow volunteers to safely outreach to those who may be in need of or are scared of being approached directly. This quick pivot by the Social Bridge team is really helping some of our most vulnerable have the resources and provides a safe way to deliver those life-saving resources for them. So thank you to Shifra and all the folks, the entire team at the Social Bridge network for keeping our seniors connected while we are doing the social distancing. So if you see a San Diego like Shifra who is stepping up, taking things above and beyond, please let us know and use the hashtag San Diegan Steps Up. Thank you to all of our participants today. Thank you for the life-changing work that you are doing on behalf of our city, our county, and our state. We are very, very proud of you. And with that, if there are any questions on today's topic from members of the media, I will be happy to answer them. I do not believe we have any. So thank you all. Thank you all for participating today, and I look forward to tomorrow's update. Thank you.